antibiotics is crucial, as Dr. Pandey explains.
The focus has to be on the preventive aspect, because curative would mean millions of dollars, lots of deaths, and we wouldn't be able to, the country will really not be able to cope with it. So prevention has to be, if bird flu should enter Nepal, we need to really contain it in the animal population and not really have it come to humans. And even if it comes to humans, to try to contain it as far as possible to limited numbers only.
Even in the misty cloud-covered hills of rural Nepal, it can be relatively easy to control large farms where flocks are housed under supervised sanitary conditions. However, control is far more difficult when birds are raised in small backyard flocks scattered throughout the country. Moreover, the issue of compensation to farmers whose flocks may have to be destroyed is a key one. The security of compensation may encourage reporting of sick animals and allow early detection.
Of all flu viruses that circulate in birds, H5N1 is the first one that we know has the capacity to cause severe illness once it crosses the animal boundary and infects humans. As yet, no real vaccines for this virus have been found.
There are many kinds of flu in birds and in humans, and H5N1 is the highly pathogenic kind, meaning it has the potential to cause serious illness in poultry, leading to death, and it also has now shown to be have the potential to cause serious illness in humans with high mortality.
The big question today is, am I going to catch bird flu? The simple answer is that by taking the proper precautions shared with you during this course, it is very unlikely that you or your family will contract bird flu. Whilst the chances of catching bird flu are low, you must remember that more than half of the people who have caught it died. Another worrying element is the high number of healthy children and young adults among those who have contracted the virus so far. So, proper precautions must be taken, and running with the birds is not advised. So what is all this talk of a pandemic? An influenza pandemic can start when three conditions are met. Firstly, a new type of influenza emerges. Secondly, it infects humans, causing serious illness. Finally, it begins to spread easily among people. H5N1 has already met the first two of these conditions.
A pandemic is an epidemic that affects all countries, or almost all countries in the world. And influenza has proven to be able to cause pandemics. This happened in the last century at least 3 times: 1918, 1957, and 1968. The worst was the 1918 pandemic. It was actually a pandemic that circulated the globe 2 times in less than 6 weeks, and 1 out of 3 persons were sick during the pandemic. That means 1/3 of the population not being able to work. And of these, millions died, 40 million died. Of course, we don't have the circumstances that were prevalent in 1918, but something similar might happen. Even worse, because international travel nowadays is faster, we communicate easier. In the past century, a pandemic happened every 30 or 40 years. So we believe a pandemic is now overdue.
As Dr. Rondera said, we may be overdue for a pandemic, but that is not the reason we are currently in a pandemic alert period. So let's see what the pandemic periods are and why we are in an alert period. According to the World Health Organization, there are 3 main periods. First, the interpandemic period, which means that the virus is circulating in wild birds and poultry, as it has been since 2003. It is highly contagious and deadly among birds, and critically, it is spreading from Asia to Europe, the Middle East and Africa.
Then, to put us into the pandemic alert period, which we are currently in, We add the circumstance that in a number of different countries the H5N1 virus has infected humans. Although human infections are present, there are very few cases of people infecting other people. Such infections have only occurred when people were in close contact.
And finally, the pandemic period will only arise if the H5N1 strain mutates into a human-to-human transmittable virus. Should this occur, no one has immunity against it. Therefore, the proportion of people infected and the number who will develop severe disease will be worryingly high.
The question left in everyone's mind is, will the virus change and therefore become a strain that is easily passed from one person to another? Unfortunately, there is no straight answer. This will depend on the genetic nature of the virus, as well as our ability to contain current or future outbreaks. The key lies in identifying possible changes in the behaviour of the virus through monitoring and investigation of suspected human avian flu cases. Therefore, the population and the authorities need to be highly aware and always alert. The fact is, the H5N1 virus might never evolve to trigger a pandemic, and we, by following the precautions, can help ensure this.
All over the world, the UN takes bird flu very seriously. This applies to us in Nepal as well. You, my colleagues who are taking part in this training course, are at the forefront of preparedness for the UN system and for Nepal. The course is designed to seize and hold your attention, and I hope that you will indeed be able to apply in your work afterwards what you learn in the course. Thank you for your attention to this brief introductory video, and I hope that the training course meets everybody's expectations.
Being aware and taking action will hopefully allow history to record H5N1 bird flu as the pandemic that never was.